I've been joined by Paul Cooke, Company Director of Healthwatch Halton. Paul, how are you today?
I'm feeling okay, thanks very much.
And how important will engagement events like this one today be for Healthwatch Halton?
They're absolutely vital. We need to get the views and experiences of our community, and this sort of event will be key to achieving that.
Fantastic. And what will be the key message that you're going to be delivering today to the members of the public that you have a chat with?
Healthwatch Halton is your independent and strong voice. That's what we're going to be. We're going to represent our community to the commissioners and the people that are putting the health services into place. They need our information, and that's what we're going to be providing.
Fantastic. Paul, thank you for your time.
My pleasure.
I'm delighted to say I've been joined by McIntyre, the Operational Director, Children's Organisation and Provision, Halton Borough Council. Anne, how are you today?
I'm very well, thank you, Matthew.
Fantastic. Are you excited to be here at this event today?
I am. I think it's a fantastic opportunity for us to be able to demonstrate how we work very effectively together.
And what's going to be your key message to the local residents and the members of the public that you meet and have a chat with today?
One of the things I want to show to the local residents and the members of the public who are attending today is how effectively we work together already, and how we can only improve outcomes for children and young people in the borough by continuing to work together in collaboration.
Fantastic. Thanks for your time.
Thank you.
I've been joined by Simon Banks, the Chief Officer of Halton Clinical Commissioning Group. Hello, Simon.
Hi, Matthew.
How are you today, sir?
I'm fine. I have slightly dodgy knees after a heavy game of football last night. I'm getting too old for it, really.
I played at the Heath last night. Yeah, it's good to hear. What do you like best about events like today's meet and greet event?
I think the meet and greet today, what I like best is actually the meeting bit, meeting local people, listening to their views, picking up with people I've probably met in the past and actually saying what you told us last time, this is what we've done about it. We're actually getting new ideas from them. Essentially ensuring that we as a clinical commissioning group engage with our local people.
Terrific. And what will be your key message to the local residents and members of the public that you have a chat with?
My key message is that we are here to change health and healthcare within Halton. You as residents of Halton are a key part of that. We can't do it on our own, we can't do it without you, so actually we need to do it together. And if you like, it's a Team Halton approach. So we want to make sure that everyone in Halton is engaged, not only in their own health and well-being, but the health and well-being of the communities they live in.
Terrific. Thank you very much for your time. Enjoy the event. I've been joined by Eileen O'Meara, the Director of Public Health from Halton Borough Council. Thank you for joining us. How are you today, Eileen?
I'm very well, thank you.
Excellent. Now, how do you feel about the prospect of meeting up to 60 local residents at today's meet and greet event?
I'm really looking forward to it. I'm sure it'll be really stimulating. Whenever I've met local residents in the past, I've always enjoyed it and learned a lot from them.
Terrific. And what will be your key message when you're conversing with different people today?
I think my key message is, in terms of public health, the important thing for people is to try to do things in moderation and to enjoy themselves, but try to think of it in terms of moderation. So when you eat, try to go for a small plateful of food that will really satisfy your appetite and also be quite healthy and good for you. And when you drink, try and stick to 1 or 2 drinks, and in between that, have a glass of water if necessary. And connect with other people, see other people, get out and about, walk, talk to your friends, and enjoy yourself.
Brilliant. Small, sensible steps that we can all take and will make a big difference overall, I suppose.
Absolutely.
Terrific. Thank you very much for your time.
Okay.
Enjoy today's event.
All right, thank you.
I've been joined by Paul McWade, the Operational Director, Commissioning and Complex Care for Halton Borough Council. How are you today, Paul?
Really good, thank you.
Excellent. Thank you so much for coming along today. What do you like best about these kind of meet and greet events?
I like best meeting people, telling them things, and then them coming back with really difficult questions. Because if we're challenged by members of the public, I think that's really important.
Yes, absolutely. And what will be your key message as you're meeting the 60 or so different residents who you're going to have a chat with this afternoon?
Okay, my key message is a simple and straightforward one. That the Council, working closely with the newly established Clinical Commissioning Group, Through that partnership, we can deliver better things for the people of Halton. It's as simple as that.
Fantastic. Enjoy the event.
Thank you.
I'm delighted to say I've been joined by Claire Duggan, NHS England Director Merseyside. Claire, how are you today?
Very well, thank you very much. Looking forward to the session and meeting everybody.
Excellent. And is that what you like most about these events, the chance to meet local people?
Yeah, I think it's the chance and opportunity to listen and to hear what people have got to say, and then to sort of see how you really get the first-hand experience of how listening to patients you can make a difference.
Yes.
And it's just a great opportunity to hear what people want to say from the Halton CCG.
Terrific. And there's going to be around 60 local residents sat in the room. You have a chance to talk to all of them later on. What's going to be your key message that you want them to take away?
I mean, what I'm after is really high-quality care for all patients now and in the future, and I'd like them to take away that they really help us by continually giving us feedback. Now that may be positive, it may be negative, and it may be somewhere in between, but whatever it is, it's really important that they have their say and we hear and action on it.
And their voice makes a difference.
A huge difference.
Brilliant.
It's the one that counts.
Thank you so much for your time today. Enjoy the event.
Thank you very much.